Are you tired of back pain that won't go away? Or maybe it fades briefly, but it keeps coming back. As a physical therapist specializing in chronic pain, I understand your frustration. In this video, I'll describe some of the most common causes of persistent back pain, plus some solutions that you can use to help relieve it. Now, before we dive into the meat of the video, it is important to know that chronic back pain is an extremely complex topic. And so I will share some of the tips that work for a lot of people, but not every solution is going to work for every person. Now, by far, the most common cause of chronic back pain that I see in my practice is hypermobility. And hypermobility means excessive amounts of movement in one area of the spine. That can be as little as a single hypermobile or unstable segment, or it can be a more generalized genetic hypermobility disorder, such as Ehlers-Danlos syndrome. Now, before you think, that's not me, my back feels stiff. One thing you should know is that one of the most common symptoms of hypermobility is stiffness. And that's particularly true if you've been sitting or standing in one position for too long of a period of time, or stiffness first thing in the morning. You may also notice that your back goes out from time to time, or that you bend over and then you have to use your arms to kind of help you get back up to standing. Or you may notice that you go to a chiropractor and you instantly feel much better. But within hours, days, or weeks, the problem comes back and you have to go back to the chiropractor again. If any of those apply to you, you very well could have some hypermobility in your spine. Now, before we get into the solutions, I want to cover some of the other treatments that people try that commonly don't work, so you can have a better understanding of why things haven't gone away so far. And the first one of those is medications. Pain medications really just cover up the symptoms, but they don't do anything to fix the underlying root cause. Even anti-inflammatories, whether they're over-the-counter NSAIDs or non-steroidal anti-inflammatory drugs, or whether they're prescription medications like prednisone or methylprednisone, or whether it's a cortisone injection in your spine. Those are strong anti-inflammatories, and if inflammation is the cause of your pain, then they will help for a period of time. But something caused that inflammation to begin with. And if you've got hypermobility in your spine, where your spine is moving a little bit too much, shearing on some of the discs and causing some spasm in the muscles around it, then it's likely that the pain will come back in the future. Now, what about surgery? Surgery is the ultimate long-term fix, right? Well, that's not necessarily true. One surgery, a discectomy, works very well in young people. That's where they cut out a small portion of the disc. But that's only effective when the disc is actually the cause of the pain. And if you look at an MRI of someone with pain and without pain, a lot of people without pain have bulging discs, herniated discs, degenerative discs, and so you can't necessarily tell from your MRI if the structure is causing your pain. Now, when that structure is causing the pain, it often does result in some long-term pain relief for a period of time. But I see a lot of older patients who have had discectomies earlier in life, and often a decade or more down the road, that discectomy contributes to some hypermobility in the spine. The reason is because the disc is the primary stabilizer of the spine. And so when you cut out a piece of that disc, it can lead to earlier degenerative disc disease and create some hypermobility down the road. Now, the other class of surgeries that people who are older tend to have is a fusion of their spine. And when you fuse two areas of the spine that are hypermobile, it does fix the hypermobility problem. But you still need to be able to move. And so eventually, a few years down the road after a fusion, it can create hypermobility either at the levels below or the levels above the fusion. So even surgeries, although they can be a longer lasting solution, they're not necessarily a long-term fix, and they don't work for everyone. Now, another common thing that people try when they have back pain is stretching. And if you have stiff, tight muscles that are working harder to make up for the stability that your spine and your discs and your ligaments are no longer providing when you have hypermobility, you would think stretching the muscles would make it feel good. And that does often feel good for a short period of time, but it's hard to stretch the muscles without also stretching the underlying hypermobile joints. And so stretching is often an effective part of hypermobility treatment, but you want to make sure that you're not making the spinal segments that are hypermobile more hypermobile, because that can lead to problems down the road. Additionally, stretching the areas above and below the hypermobile segments are important, and we'll get into that a little bit in the tips. Now, what about core stabilization or core strengthening? That's another thing that people try. And the term core strengthening, I think, is not really a good descriptor, because when your muscles are tight trying to stabilize the hypermobile segments in your spine, doing aggressive strengthening, trying to contract the muscles and make them stronger, actually leads to those tight, stiff, overactivated muscles getting more tight, stiff, and overactivated. So strengthening is probably not the best thing to do, but learning to use your muscles to control your spine in the right amount, at the right time, and in the right proportion with other muscle groups is very important. And we'll get into those when we get into the tips. There is one other really important thing that we need to discuss, though, before we get into the tips, and that's the psychosocial contributors to chronic pain. Most people don't like to discuss that because there's the implication that they're crazy or that it's all in their head, and many people with chronic pain do in fact hear things like that from their family, their friends, or even their doctors. That's why I've written a book called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. And you can pick that up on Amazon if you would like some additional tips besides the ones that I offer in this video. The short version, though, is that your thoughts can influence the intensity or the amount of pain that you experience. It can make your nerves more sensitive and more readily relay messages from your tissues up to your brain. However, it rarely is the pure cause of your pain. Your pain is rarely ever all in your head, but your thoughts and your brain do influence the intensity and the amount of pain that you experience. So now let's get into the tips to help if you do experience persistent pain in your back. The first tip is proper posture. If you remember, I mentioned earlier, people with hypermobility tend to get stiff when they're in any one position for prolonged periods of time. Now, there's no ideal posture that's best for every single person. And often with hypermobility, changing positions and postures regularly is one of the best things you can do. Hence the common phrase in physical therapy, your next posture is your best posture. But sometimes you do have to sit still for long periods of time. When your spine is stacked up like a tower of blocks, so that one vertebrae supports the vertebrae below it, your muscles don't have to work that hard to stabilize you. But if you start getting into excessive amounts of arch where things aren't supported by the segments below, then your muscles have to work much harder to stabilize. Your spine normally has some back and forth curves, and your spine shouldn't be straight up, but you also don't want those curves to be hyper exaggerated. And I'd say in people with chronic pain, it's much more common to find accentuated curves than completely flat curves. So one thing that tends to happen is that you go more into the natural curves of your spine. So you tend to go into hip flexion or anterior pelvic tilt, excessive extension in the lower back, and then excessive flexion or rounding in the mid-back. Now, it's not that way for everyone. You want to try to maintain neutral curves of your spine when you're sitting or standing for long periods of time. That may mean sitting up against the backrest when you're sitting, so your back's nice and flat up against it, or when you're standing, kind of tucking your pelvis underneath so that your pelvis supports your spine above it. Now, next, we want to go into stretching. I mentioned with hypermobility, it helps a lot when people get manipulated at a chiropractor. And manipulation is often a good thing to do for a short-term fix. But you don't want someone cranking on you really hard. Many people with hypermobility can crack their own back just by kind of twisting over like that, or twisting over the other way. And if you can position yourself and get a nice little pop that feels good, that is perfectly fine to do. But you don't want to crank on yourself or have a chiropractor crank on you because that causes excessive mobility. How you do want to stretch, though, is stretching out the muscles that are stiff. So if you tend to be in hyperlordosis like this, doing forward bending stretches to stretch out the stiff muscles in the lower back that hold you in that extended position is a good idea. That can be bending forward in standing, it can be bending forward in seated, or it can be rocking back on all fours. This is sometimes called the child's pose or the all fours rocking stretch. Now, sometimes if you have really a lot of stiffness in your lower back, you can go all the way down into flexion like this, and that stretches out the muscles in the lower back. Additionally, this exercise can be done in a different way, where you keep your spine in a neutral position like this and rock back while keeping your spine in more of a neutral position. And this helps stretch out the tissues in the back part of the hips, which can also become stiff if you have chronic lower back pain. And in fact, if you move too little in the hips, it's more likely to create hypermobility or excessive mobility in the back. So that's another good solution if you do have stiffness in your hips and hypermobility in your lower back. Just rocking back like this, keeping your spine nice and stable, and holding for about 10 seconds in this back position, then rocking back forwards. You may note that you start to feel a little pinching in your groin, and you don't want to push past that. Just go to the point where you feel the stretch in the hips, but not to the point where you feel pain. Now, another thing that's helpful for people with lower back pain and excessive amounts of lordosis or extension in their lower back is stretching out the hip flexors. The hip flexors attached to your spine can actually pull you into that excessive arch or excessive lordosis. Now, one good way to do that is lying off the side of the bed, and this is the hip flexor you're going to stretch. So you pull the other knee up towards your chest, keep your lower back nice and flat, so it flattens out the curve of your back, and then just drop this leg off the edge of the bed. Now, if it's going really far and you're getting arch in your lower back, that's not good, and that can actually start to make you hurt worse. So it's really important to make sure that you keep your lower back flat on the bed, this knee held up to your chest as you drop this one down. Now, while you're in this position, this can also be a good mobilization for your SI joint or your sacroiliac joint, that joint right between your pelvis and your spine. Many people with hypermobility, particularly women who are either pregnant or who have had several children, tend to get stretchy ligaments in their pelvis. And that can create those joints locking up over time. So if you do tend to notice that your SI joint gets locked up, this can be a good stretch to do, dropping one leg off the edge, pulling the other one up towards your chest. Then you'll kick out with this leg while resisting with your hands, and then pull in a little closer. Kick out again, and pull in a little closer, and kick out again, and pull in a little closer. Now, a lot of times it's the sore hip or the sore SI joint that you'll kick with, but if that doesn't fix the problem, then do it with the other side. The pelvis is a ring, so if one side doesn't work, typically the other side will. Now, some people find it really difficult to stretch their hip flexors lying off the edge of the bed like that. So here's a tip if that happens to apply to you. You can also stretch your hip flexors in a standing position like this, where you roll your pelvis underneath of you, and then you should feel a stretch in the front of your thigh there. It's important to keep your lower back tucked under, so you're doing a little pelvic tilt and stabilizing your spine here while stretching the front of this thigh. And hold this for about a minute or so. Additionally, if you have a lot of arch in your lower back, your upper back tends to get rounded. And so another good way to stretch what needs to be stretched while stabilizing what needs to be stabilized is to stand with your lower back up flat against a wall. Pull your belly in to flatten your lower back out on the wall, and you may notice that your upper back rounds forward. If that happens, this is probably a stretch that you need to do. So keep the lower back flat up against the wall and bring your arms up like this and try to lift your shoulders back towards the wall while keeping your lower back on the wall. So you don't want to allow your lower back to arch like that as you're bringing your upper back up. So again, lower back flat on the wall. Bring the arms up like this and then come back this way while keeping the lower back flat on the wall. This mobilizes your upper back, stabilizes your lower back, and also stretches your chest muscles at the same time. Now, if your muscles are working really hard to stabilize your spine, sometimes stretching won't necessarily work. If those muscles are held together and are very stiff, you'll find that it may be hard to stretch them out, or sometimes stretching the painful muscles may even cause further pain. If that's the case, you may need some tips just to get the muscles to relax without stretching them. And one great way to do that is doing diaphragmatic breathing or belly breathing. That activates your parasympathetic nervous system, your rest and digest system, and helps calm down a fight or flight response, which makes your muscles get tight and stiff and ready to run or fight or respond to danger. So to do diaphragmatic breathing, it helps to lie down on your back and take one hand and put it on your belly and the other hand and put it on your chest. And just take a deep breath in. Now what most people will do is they'll breathe in like that where their chest rises, and it makes a lot of like a nasal breathing sound. But what you actually want to do is a quiet deep breathing. When you use your diaphragm, a dome-shaped muscle that sits between your rib cage and your abdomen, the diaphragm drops down, and that actually causes your belly to rise up. So you want to breathe in by pushing your belly up. Now you don't necessarily have to think about breathing in. If you just push your belly out, make your belly rise, air is naturally going to flow in as your lung volume increases. Then to breathe out, just let your belly fall. You don't necessarily need to force it. So breathe in, focus on belly rise, belly fall. And then just practice doing that. Belly rise, belly fall, keeping your chest fairly still. Your chest will move a little bit, but you want your abdomen to move first and move most. So focus on belly rise, belly fall. And doing this in a quiet, calm place, either with or without music, can be a nice, helpful way to get your muscles and your body in general to relax. So that's diaphragmatic breathing. Now, if you want some more specific tips for individual muscles, some common ones that get stiff or tight when you have chronic lower back pain are your hip flexors, specifically your iliopsoas, and your quadratus lumborum. Now, for the hip flexors, you can find those kind of inside your pelvis right here. This is the iliacus that runs right inside your pelvic rim right there. You have to dig down kind of deep to get to it. Your psoas lies right on the side of your spine, runs down in a diagonal this way. So to find your psoas, dig in with your fingers and just kind of press in like that. You want to press in until you feel a pressure. It should not be incredibly painful. And just holding a gentle pressure like that can sometimes help those muscles to relax. Moving down to the iliacus, it's just inside the pelvic rim. Just hold a gentle pressure right there, and that can help that muscle to relax. There is also a tool called the Psoas release tool, and this can be helpful for releasing your hip flexors. You just put it right in between your hip bones or slightly above, and then just put a little gentle pressure down like this. You can also lie on it on the floor, but that is a little bit more uncomfortable It's probably for people who are a little less irritable in their symptoms. But just lying down like this, lower back flat on a bed or on the floor, and putting a little gentle pressure in like this can be a good way to get your iliacus and psoas to relax. Now your quadratus lumborum runs on either side of the spine. It gives you side to side stability. And so if you notice that you're really stiff and tight on one side of your spine and it feels kind of deep in, your quadratus lumborum is most likely involved. Now, one way that you can get that to relax is actually using a breathing and stretching technique at the same time. To do that, raise one arm up in the air on the side that you're sore or tight and kind of lean forward on the opposite knee like this. Now take a deep breath in. And because that quadratus lumborum attaches to your 12th rib, when you breathe in, that's going to cause your rib to rise, just stretching the quadratus lumborum. And then breathe out and try to hold your arm up in the air as you breathe out. Breathe in, the rib cage will rise and that'll stretch it a little farther. And then breathe out. And repeat that for a series of about 5 deep breaths. Now, if you are more stiff or tight on one side, this may be a good one just to do on that one side. Now, what about core strengthening exercises? Core strengthening exercises are one of the most commonly prescribed physical therapy treatments for lower back pain. But on an everyday basis, you don't use your absolute core strength all that often. If you're lifting something very heavy, that requires core strength. But just walking around, going to the grocery store, being able to stand cooking dinner, that doesn't require core strength. More often, what people need is motor control. Being able to fire the correct muscles in the correct amounts at the correct time and in the proper sequence with other muscles. When you're moving around and going about your day, often you need to stabilize the lower back while moving the arms and legs. And that requires proper motor control. Now, I've got other videos on motor control and core stability exercises, so I'm not going to cover those here. But before I shoot you over to those other videos, if you would like some more tips to help with chronic back, knee, neck, or jaw pain, you can pick up a copy of my book on Amazon. And if you found this video helpful, hit the share button below this video to share it with others who may need help. Thanks for watching, and I'll see you in the next video.